The honourable member from Thornhill.
The Liberal government's dangerous drug policy in BC allows people to smoke crack on a public bus, to shoot up next to a park with people with children playing there, to blow smoke from meth in the face of a nurse in a hospital. Now we learn what the Liberals want to do to Toronto, what they've done to BC. The Leader of the Opposition sent the Prime Minister a letter asking him to reject Toronto's request. Are the nurses in Toronto getting people who smoke meth in hospital rooms, or will they finally reject the request?
The Honourable Minister for Mental Health and Addictions.
Mr. Speaker, on this side of the House, we are completely committed to working with communities across this country in facing the opioid crisis and the tragedies that are happening to so many families. Every request is reviewed on a case-by-case basis. The member should know this. Toronto Public Health has not submitted a proposal that adequately addresses the dual objectives of public health and public safety, which have guided us throughout addressing the opioid crisis. Every level of government, including the province, must be engaged in this process, and we continue to work together.
The honourable member from Thornhill.
Speaker, their plan is killing 22 Canadians every day, and opioid deaths have doubled in this country in just 2 years. I can't believe that the minister from Toronto wants to expand this lawlessness into her own city. Otherwise, she would just say no. I'll give her an opportunity to just say that. One more opportunity to stop this extremist experiment on the streets of Toronto. Yes or no? Will you reject it?
The Honourable Deputy Prime Minister and Minister of Finance.
Mr. Speaker, I'm a minister, I'm a Toronto MP, I'm a Toronto mother. I know, as everyone in this House should, that the opioid crisis is a tragedy, and there are no families in Canada that are untouched by it. The BC pilot project was requested by BC. BC has serious concerns. We share those concerns. We are addressing it. There is no other pilot project anywhere in Canada, and the BC experience should and will be instructive.
The honourable member from Durham.
Mr. Speaker, it's been 24 hours since the Leader of the Opposition sent the Prime Minister a letter asking him to reject Toronto City Hall's request to legalize hard drugs. And we're getting no serious answers from this NDP Liberal government. After seeing death and disorder in BC, why can't the Prime Minister take the no-brainer and say no? At what time today can we expect an answer to Toronto City Hall?
Hear, hear. The Honourable Deputy Prime Minister and Minister of Finance.
Mr. Speaker, I think the members opposite were not listening to my previous answer. The only pilot project in Canada is in BC. BC has serious concerns. We share them, and we're acting urgently together to resolve them. There are no other pilot projects anywhere in Canada. I think all Canadians are aware of the BC experience and need to take it into account. But you know what, Mr. Speaker? We've invested $200 billion in the healthcare system. They voted against it.
Yes.